Have a really good self-awareness of your body. Listen to your body. Bodies like movement, and a lot of us live a much more stagnant lifestyle these days, and getting out in the fresh air. So movement outside would be my absolute number one tip for everybody. If your body's moving and it's outside, getting the sunlight when we get it, but breathing in the fresh air, it helps all of the processes within your body to function at a more normal level. Bodies don't like going down the holistic health rabbit hole and thoroughly enjoying the journey and finding out more about all these incredible things that I knew nothing about beforehand, and how a combination of those can be suitable for most people. And everybody's different. We don't all need the same thing. And I think that's something else that started to steer me away from traditional medicine, was that even though there are varieties within there, it's all the same bucket that it's coming out of. There isn't anything different for people that either just don't want that or it doesn't suit them. So I now feel that there are so many other ways that you can address problems that you may be having with regards to the way your wretched hormones make you fat. Is basically saying move enough and try and eat the right kind of foods to try and resist the build-up of abdominal fat. And the third thing, really fundamental, just sleep. Just so many basic things, and be aware. You know, if you feel exhausted by 9 o'clock at night and you're thinking, well, I used to go to bed at 11:30, midnight. So what? Listen to your body. Go to bed at 9 o'clock. That's what it's absolutely. I mean, just as a fact that even if we eat really well today, we can still struggle to get the nutrition that we need from our food. I saw a statistic somewhere that said by eating, you would have to eat 20 oranges today to get the same nutrition out of what that you would have done out of one orange sort of 50 years ago, because of what we've done to our food growing processes. I mean, that's really bad, isn't it? You know, if people are trying hard and still failing, and it's none of their own fault at all.
No, I mean, this is what I'd heard about, about our food, that actually even the healthiest of people, without some sort of supplements, we're just not getting the same out of our food that we used to. And also that a lot of them have got herbicides and pesticides that are estrogenic, hormones fed to our meat.
Gosh,
so there's lots
of
other
other rabbit holes. To know exactly where you are if you're still having a cycle when you have that blood test done. And I would suggest that more than one, which is more money, I appreciate that, but at different times in your cycle. And if you're not particularly having a cycle, at least just different times of the month that would represent different cyclical changes if you were still having them. And just to see, because a trend is always more informative than a one-off measurement.
And I think this is the problem, isn't it? That if you go to your GP, usually it'll just be a one-off and not always. I have noticed some ask where you are in your cycle and then will choose to do the blood test around then. But actually, what's unfortunate is there are many that just go, okay, just go and have a blood test and don't sort of say when or... And then this is when the discrepancies, I think, are coming in, when women are getting results back saying that they're normal, whatever their normal base is, and yet they've got 20 plus symptoms.
Yeah. So they're
and I think
not.
This is where on my journey as a physio, and I even did women's health just to try and bridge a gap in my knowledge and it was all about, sort of pregnancy, prolapses, things like that, but there was no mention of hormone or menopause. And I knew, women were more predisposed. We were taught that they're more predisposed to frozen shoulder, tendinopathies, joint pain, but I didn't know why. And I look back and go, yes, my treatment helped what I was treating, but I wasn't treating the cause. And it's across the board. I mean, I saw a gist for my heart palpitations, and I always advise women, always get everything checked to make, rule out any other causes. But not once did they mention it could be down to hormones, and they even offered me beta blockers. And thankfully I kind of had the attitude of, well, will I die without them? No, you'll just get the symptoms. That's fine, as long as I'm not going to die. I'm not going to take beta blockers. My dentist gave me a lecture on oral hygiene when I was spending nearly £1,000 to stop my teeth falling out. And again, not one mention of hormones, which we get free dental care in the UK when we're pregnant because of these hormones make your gums more likely to have issues.